Good evening. Today, our lecture is devoted to the skull anatomy. We start to study anatomy of the bones, of the head bones. And as usual, I'd like to know if you hear me clearly. Send me feedback. I see only 12 student from 3 group. It is a little bit strange because all students should visit every lecture. Okay, I see. If you hear me clearly, then let's get started. The skeleton of the head or skull, in other words, is the most famous part of the human skeleton. It is also the favorite object of artists. As you see a picture made by Vasily Vereshchagin. He was famous. He is famous Russian artist and painted a lot such picture. And this one named Apotheosis of War. And you see a lot of skulls on the battlefield, and you see the skulls which is the object of the art object here. If you have chance to visit one of the famous Catholic church in Sedlik, this is a Czech Republic in Europe, you could see these structures. There's a lot of bones and skulls inside of Catholic church. I was a little bit surprised. It is not a correct word to say I was surprised. I was a little bit shocked that such real human bones are object of the interior. This is a part of church. I would say equipment or some kind of artist inside of Catholic Church. And this is, of course, a skull in real life, in religion, in Catholic religion. This is the medicine and real life cases. And as you see, traumatic of the skull is a heavy injury. And this situation is most common during the catastrophe and some unhappiness situation. And of course, the injury of the skull is the most severe injury in medicine. I show you the picture when traumatic injury of the skull visible here. You see the air coming through nasal cavity and is under the face skin. It looks terrible, but that is the real life. I would add that up to 49% of all injuries and almost 50% of all fatalities are the skull injuries. So it is very important to know anatomy of the skull for a lot of doctors, not only for neurosurgeons but also for ophthalmologists, for the dentist and other professions. Here you see the injury of skull. This is a light injury, but this one you see very severe injury of the skull. This is a fracture of bones in the neurocranium. This is a part of the skull which is the capacity for the brain. The skull functions, you see the first important function is that skull is a seat for the brain, and it protects the brain against injuring not only the brain but also for things, organs. And the second function is that the bones of facial skull form initial section of the digestive and respiratory system. It is the beginning for digestive tract and for respiratory pathways. By the skull we have possibility to eat and to breathe. This is an entry for food and for air. In accordance with the above function, there are two parts of the skull. You see that human skull we can divide, or we can internal organs like tongue, dents, salivatory glands and other. But inside of brain box we could find only brain. And as you see, the neurocranium is divided into the Calvary. This is a part, interior part. Usually this is this part of neurocranium. But also we could distinguish the cranial base, which is consist of two parts or two surfaces, outside surfaces here and inside, where brain is located. Here I'd like to show you where the bones of neurocranium and viscerocranium are located. We start from the neurocranium. This is the frontal bones. I'd like to pronounce it in Latin. Os frontale. Second is sphenoidal bone, or os sphenoidale in Latin. Next is temporal bones, or os temporale. This bone, called parietal bone, or os parietale in Latin, located between frontal and occipital bones. It's paired bone. The posterior part of neurocranium is formed by os occipitale in Latin, or occipital bone. We also see internal bones of the nasal cavity. Its name is ethmoidal bone, or os ethmoidale. Now is turn for viscerocranium bones. Number 7, that is a paired bone called maxilla. Number 8 is mandibula in Latin. Then lateral part of the face is formed by os zygomaticum, number 9. The dorsal part of the nose is formed by paired os nasale, or nasal bone. Those bones are paired. We see left and right nasal bones. Inside of orbit, we see the small and fragile os lacrimale, or lacrimal bone. In nasal cavity, you see this part, these bones, located in median plate and called vomer in Latin. Then the posterior part of the bone palate called os palatinum. And in nasal cavity, you also see paired two bones called concha nasalis inferior. And only one bone, skull bone, is located not on the head, but on the neck. And it is named os hyoideum. You can touch, if you put your finger on the larynx and up to the larynx, you can touch the hyoid bone. Hyoid bone. It looks like a small curved bones. I will show it, these bones. Take in consideration that this bone is located on the neck, but not on the head. You should know the border between calvaria and cranial base of neurocranium. As I said before, the upper part of the cerebral skull is called calvaria. This is the Latin name. Notice that except of English names of anatomical structures, you also have to know Latin names or Latin word. So I will further tell you the Latin name of all anatomical structures. Well, the upper part, this part of neurocranium, we call calvaria. The lower part of the neurocranium called cranial base. Cranial base. This is this part of neurocranium, that is cranial base. Both of these parts have different strength, surface relief, development characteristics, and different clinical symptoms when skull is damaged. The border between the base and the calvaria is drawn along the following anatomical landmarks. Each doctor should know this border, and every student as well, because it is necessary when doctors formulate the diagnosis in case of trauma or head injury. For correct formulation, you have to know the real border between Calvary and cranial base. Алло. Сам Владимировна, лекцию пока читаю. Перезвоню, ладно? Ладно, спасибо. Угу. Хорошо, перезвоню. Угу, спасибо. Where is the location? I'll show you this border. It starts from glabella, from here, go up to the orbiter through the arcus supraciliaris, this is a Latin name, from here, to the processus frontalis of os zygomaticum, then go through the crista infratemporalis, here with crista infratemporalis, it is located on the sphenoidal bone, then go to the base of process of the zygomatic process of the temporal bone. This is zygomatic process. Up to the meatus acousticus externus. This is the meatus acousticus externus, and up to it the border path. Base of next line goes next to the up to the or base of the mastoid process. Here is the mastoid process. This is mastoid process, and then superior occipital line finish come to the end on the external protuberance or protuberance occipitalis externa, located on the occipital bones. So this is the line this line divides the cranium. Up is calvaria and down is the base, cranial base of the skull. Some of topographic formations students have known, and let's look at the one of the most important topographic formations of the cerebral skull. There are 3 cranial fossa inside cerebral skull. You can nicely see different color of 3 cranial fossa. This is the anterior cranial fossa. It has a yellow color. Behind it, middle cranial fossa are located. This is the middle cranial fossa, and it is the green. And the posterior position inside of neurocranium, you could find posterior cranial fossa. It is blue. Anterior cranial fossa, Latin name fossa cranii anterior, lies at the highest level of the internal cranial base, and it is formed by the cribriform plate of the ethmoid bone. Here you see ethmoid bone and its cribriform plate. Also orbital plate of the frontal bone and the leather wings of the sphenoid. Here I show again. This is the cribriform plate of ethmoid bones. This is orbital plate of the frontal bone, and small part is formed by leather wings of the sphenoid bone. The middle cranial fossa, fossa cranii media in Latin, is the region of the internal cranial base between the anterior and posterior cranial fossa. This middle cranial fossa lies deeper and it is wider than the anterior cranial fossa. You see the central part of the middle cranial fossa we called hypophyseal fossa, because here in the centrum of the central part, middle cranial fossa, located hypophysis. This is a very important endocrine gland in our body. Except of central part, the middle cranial fossa has two lateral parts where temporal part of the brain, temporal lobe of the brain are located. The posterior cranial fossa, Latin name is fossa cranii posterior, lies at the lowest level of the internal cranial base and is the largest of the three cranial fossa. You see that it is located deeper, and the size of the posterior cranial fossa is bigger. That's why it's the largest cranial fossa in the neurocranium. I hope you guess what means neuro, because cranium, this is the name of skull. It is a Latin name. So we call the science or the part of the anatomy, human anatomy, called craniology. This is the science which studies the skull bones, but neuro means that some part belong to the central nervous systems or brain, in other words. It is important to know all openings connecting all cranial fossa with other parts of the skull. First of all, you have to show in the real skull, in the or the plastic model, or on the real skull in our department, you have to show these openings in the anterior cranial fossa. First opening, there are a lot of small foramens or openings called Foramina cribrosa in Latin. This is small holes between nasal cavity and between anterior cranial fossa. The cribriform foramina are located on the ethmoid bone, and these foramina connect. This is a pathway for ophthalmic or olfactory nerves. They come from the nasal cavity and bring to the brain the sensitivity of the smell. When we test something, it's possible to understand is it good smell or bad smell. And the nerves coming through the cribriform foramina here, you see this is a yellow small nerves. This is a olfactory nerves. They serve as a olfactory sense for humans, for people. So please remember, anterior cranial fossa have only one opening. This is the cribrosa foramina in Latin. Opening, there are many openings in the middle cranial fossa. They connect it to other parts of the skull. There are the following: optic channel, canalis opticus in Latin, here. Superior orbital fissure, fissura orbitalis superior in Latin. Все хорошо. Алина вам прислала все? Спасибо большое. Спасибо. Well, this is the Latin name, but here is the English name. Optic canal is English, and this picture is also there are the name of nerves and another anatomical structure like arteries or veins. They pass through the opening, so it is very useful just to see not only the opening but the structure in those openings. As you see, superior orbital fissure has a lot of nerves, and they this is the cranial nerves. We will study these nerves on the next year in the autumn semester, when we will study peripheral nervous system. Then you see another foramen, we called foramen rotundum. Foramen rotundum, this one is foramen rotundum, and it contains maxillary nerve. This is also the one of the ramus, or the this is part of trigeminal nerves, 5 part of cranial nerves. This is a 5 in Italian, or rim. We call it rim numbers. Well, next, quite large foramen we call foramen ovale. This is the same name in Latin, foramen ovale. In Latin, ovale, foramen ovale in English. And it is also the path for mandibular nerve. Here you see the laterum foramen laterum. This is the foramen with a sharp edge, like it was tiered. So lacerum in Latin means tiered foramen. And through these foramen, deep petrosal nerve and greater petrosal nerve come through. Next is carotid canal. Here, this is a carotid canal inside. You see also the opening for carotid canal outside on the cranial burst. Here, this is the entry and exit of internal carotid artery. So that's why the name is carotid, means carotid artery canal. And we also see two canal inside of the middle cranial fossa. You see two hiatus of the canal for the lesser petrosal nerve and as well for the greater petrosal nerve. Two canal. Where they are? They are here, canal for greater nerves, but here the canal for lesser petrosal nerves. It will be better if you take a look on the real skull and see this small hiatus on the real specimens, on the real skull specimens. Well, next opening we will see inside of posterior cranial fossa. I'll show you the border of the posterior cranial fossa. this is, and this is the posterior part of the body. And what kind of openings we find here? There are inner acoustic meatus here, inner acoustic meatus. Sorry, this is my mistake here in the internal acoustic meatus. The inner acoustic meatus is a paired canal connecting the posterior cranial fossa and the facial canal. It transmits the facial nerve, and you see this is the facial nerve, and the vestibular cochlear nerves. This is a cranial name number 7. I mean facial nerve, but vestibular cochlear nerves we called 8 pair of cranial nerves, number 8 in Latin digital, in Latin numbers. Below the inner acoustic meatus, you see the jugular foramen here. This is a large opening where located 3 cranial nerves, and the jugular foramen forms bilaterally between the occipital and temporal bones. Here is visible that anterior part or jugular foramen is temporal bone, but posterior part is formed by occipital bone. This foramen leads to the external surface of the cranial base, and you see also here the jugular foramen. It is also visible here, outside of neurocranium. The jugular foramen transmit the inferior petrosal and sigmoid sinuses and 3 pair of nerves, glossopharyngeal, vagus, and accessory nerves. Numbers 9, 10, and 11 pairs of cranial nerves. You also can see here the hypoglossal canal. It leads to the external cranial base and carries the hypoglossal nerve. This is the cranial nerve number 12. We have only 12 pairs of cranial nerves, and the 12 nerves transmit through the hypoglossal canal. There are also, we call meatus acousticus internus, we call the foramen jugulare, and we called hypoglossal canals. But there are also the biggest hole in the posterior posterior cranial fossa, we call foramen magnum here. It is the biggest foramen in the skull because it is a place. This is where this foramen connects the posterior cranial fossa with the external cranius base, and it leads to the vertebral canal. This foramen magnum transmit the lower end of the medulla oblongata. It is also transmit the vertebral artery, the spinal root, and also of some parts of the accessory nerve, and some of spinal arteries. We will study this structure the third semester or the second year. Small apertures and foramen mastoidum consist of they are not large, but they have previously the venosus structure for the brain veins. This picture is very interesting because it shows us the lines for typical fractures of cranial fossa. And as you see, these lines, those are red lines, and when they come through the cranial openings, it's visible here, and let's go through the foramen magnum and through the foramen jugular foramen and through the meatus acousticus. So it means the fractures of the cranial fossa can injure the vessels or the cranial nerves, and that is pity, because during after fractures, after some injuring situation, patients will have problems with the innervation and blood circulation in organs of the head. But not only head, but also for neck organs and for thorax organ, and even for abdominal organs. That's why the fractures of cranium are heavy injuries. And see, this is the fractures through the cranial base, through the anterior cranial fossa, and it leads to the rhinorrhea when cerebral liquid come through the nasal cavity, transmit nasal cavity and visible on the face. This is the drops of cerebral liquid. The fracture of middle cranial fossa here. This is a fracture of cranial fossa. I forgot to say that when we not me, but when patients have fracture through the anterior cranial fossa. This is the interesting clinician symptoms we observe on the patient. This is like a glasses. This is a blood coming through the orbits, and it's visible under the skin. And here you see in the computer tomography the sections or the parts of the brain after trauma, after fracture of the cranial base. During auto catastrophe, when machine jump each other or touch each other on this very high on the highway, and sometimes we see such symptoms during this type of fracture. What about middle cranial fossa injuring? Usually it is also heavy, but you see the otorrhea, we call in Latin. This is the drops of cerebral liquid coming through the meatus acousticus external meatus acousticus. But the heaviest, the most serious problem patient have when it happened, when the fracture of posterior cranial fossa happened. This is when that is difficult, because here located medulla oblongata, very important part of the brain, where located breathing and breathing centers. If this center of breathing is damaged, no possible to breathe. So this trauma, this injury is very, very problematic for patient. Next structure we see on the lateral part of neurocranium, and here there are two fossa called temporal fossa or fossa temporalis in Latin, and infratemporal fossa infratemporalis in Latin. They are located here. Number one, that is temporal fossa. Number two is infratemporal fossa. They have irregularly shaped space and located deep to the ramus of mandibula. Here usually the mandibula, lower jaw, and inside to the mandibula we could see these two fossa. Next fossa are located between sphenoidal bone and maxilla, and it is called pterygopalatine fossa or fossa pterygopalatinus. It is a cone-shaped bilateral space on the lateral side of the skull, below the apex of the orbit. As I said, this space, this the pterygopalatine fossa is formed between the maxilla, sphenoid, and palatine bone. Actually, three bones form this fossa. And pterygopalatine fossa has got 6 connections between different spaces, different cranial cavities. And you have to know and show these openings and these connections. First, number 1 is fissura orbitalis inferior, fissura orbitalis inferior orbital fissure is a space between the sphenoid and maxilla and connects pterygopalatine fossa with the orbit where eye is located. The second opening is sphenopalatine foramen. Foramen. We should add the letter N. Foramen sphenopalatinum in Latin. It is found in the medial wall of the pterygopalatine fossa, and it connects this one with the nasal cavity. So this is the way from pterygopalatine fossa to the nasal cavity. The third opening is the greater palatine canal, in Latin canalis palatinus major. Here you see this way from pterygopalatine fossa to the oral cavity. Next opening, number 4, we call foramen rotundum or foramen rotundum in Latin. This is the foramen in middle cranial fossa, and it comes through the sphenoid bone and goes and pass to the pterygopalatine fossa. So this is a connection between the middle cranial fossa and the pterygopalatine fossa. As I said before, foramen rotundum conducts only one structure. This is a maxillary nerve. Here, only one nerve coming through this foramen. And pterygoid canal connect the pterygopalatine fossa with the middle cranial fossa, but outside. It means this is a connection between outside cranial base and the pterygopalatine fossa. And the number 6, this is the pterygomaxillary fissure. This is a large fissure. Actually, this is opening forming the lateral boundary of the pterygopalatine fossa and connecting it with the infratemporal fossa we just studied. Next formations we see in the facial part of the skull or facial skull. First is nasal cavity. This is a space inside the skull that is divided into right and left sides by a vertical partition called the nasal septum. Here you see this is the nasal septum. This is deleted, and that's why the nasal cavity has two parts, left and right sides. Inside of nasal cavity you could find three nasal meatus: superior, middle, and inferior meatus. They are located between nasal conchas, superior concha and middle concha. Between them located superior meatus. Between the middle concha and inferior concha is located middle meatus. Middle meatus is located. And between the palatine process, between palatum osseum and inferior concha, there is inferior meatus here. This is a pathway for air passing through nasal cavity, and mostly air transport through the three meatus: superior, middle, and inferior. This is nasal meatus on the epoxy plastinated specimens or section, because that is a section. You see the line of section on the head, and you see the nasal cavity here, and the arrows show the three small meatus: superior, medius, and inferior. Here is superior, here is medius, here is inferior. But also you see the common nasal meatus, or we call it in Latin meatus nasi communis, because it is between nasal septum and all of conchas. This is all of these meatus transform air to the lungs. Paranasal thymuses are cavities within certain cranial and facial bones near the nasal cavity. They are most evident in sagittal section of the skull. If we prosthesis the sagittal section, those paranasal sinuses can be shown, but it is also visible on these schemes. All sinuses, paranasal sinuses, are lined with the mucous membranes that are continuous with the lining of the nasal cavity through a small opening in the lateral wall of the nasal cavity. Secretions produced by the mucous membrane of the paranasal sinuses drain into the lateral wall of the nasal cavity. Paranasal sinuses are rudimentary or absent at birth, in the period after birth, and then they increase in size in adults. Paranasal sinuses arise as outgrowth of the mucous lining of the nasal cavity that project into the surrounding bones. Skull bones containing the paranasal sinuses are the frontal bones. Here you see frontal sinuses in the frontal bones. Sphenoid bones, this is violent sphenoidal sinuses. Also, some of cellular ethmoidal also have air inside them, but the largest sinus is located in the maxilla, and we call it maxillary sinus. Sometimes these sinuses are filled with, after inflammation, are filled with the fluid, and that cause the problem for patient. And they feel themselves bad. So surgeons need to open these sinuses, and you see this is a connection between different paranasal sinuses and this is connection between nasal meatosis. So it's possible to come through the nasal cavity and to evacuate the liquid from the different sinuses. I'll show you the video explaining this process. This is a video, and you see how it was done. Okay, I hope now you understand what doctors do with such patients. Okay, this is some kind of double maxillary sinuses, and the next sinus, next cavity on the face called orbit. This is a cavity for the eye, where eye is located, and it has four walls. This is the superior wall, lateral wall, inferior wall, and medial wall. I hope you guess that the orbit accommodates and protects the eye and its accessory structures. The shape of the orbit resembles a pyramidal structure with an apex. Here is the apex, directed posteriorly, and the base, this is the base of this cavity, situated anteriorly. Each orbit opens on the supraorbital margin. This is the supraorbital margin, and infraorbital margin. Here is the infraorbital margin. As you see, there are a lot of openings connecting the orbit with the other cavities on the skull. Here is the superior orbital fissure. This is inferior orbital fissure. Also, you see the optic canal and the infraorbital groove passing to the infraorbital foramen, and also the large canal on the medial wall of the orbit called nasolacrimal canal. This table show you what kind of anatomical structure come through these openings. For example, in optic canal there are optic nerve and ophthalmic artery. So it is important for study angiology and neurology when we will do in the second and the third semesters of your study. And here also visible name of orbit openings. Please notice and study all of this structure. You should not only know these openings, you also have to show these openings on the skull specimens. And today I'd like to show you some of X-ray imagination and or computed and tomography of the skull. First is the lateral view, lateral projection of the human head, and you see the skull. And I show you some of the anatomical structures. Here, this is the frontal sinus. This is the border of maxillary sinus. You can nicely see anterior cranial fossa, middle cranial fossa, and inferior, posterior cranial fossa. This is anterior, this is middle, and this is posterior. In the middle cranial fossa, you can differentiate it, the hypophyseal fossa, where hypophysis is located. You can see also the mandibular here with the teeth. This is the two parts of mandible, left and right. This is a projection of mandibular. Here is visible the maxilla and some of the bones, nasal bones, frontal bones, parietal bones, occipital bones, and the central part. It is a heavy shadow structure called pyramids of temporal bones. That is enough for lateral projection. Anterior projection or frontal projection is also visible. All of structures. We just talked them about before. This is the maxillary cavity or sinus. Doctors very often call it Hymer's sinus, Hymer cavity. It is better visible to show you the nasal chin projection when all of sinuses are visible. Frontal, this is the maxillar, and here's the large frontal sinus, this patient. Here is the nasal septum, and this is the mastoid processus with the air inside, and upper and lower jaw, maxilla and mandibular. But as you guess, this is the orbit here. Orbit. I hope it will be easy to show this on that. This is a special examination of the dentist or teeth tooth when dentist recommend patient to do before treatment. This is all teeth on the maxilla and mandibular. This kind of X-ray tomography called orthopantography and some of computed tomography, CT scan. You see the cut. It is visible like a cut of the head with the real brain inside, and you see the mandibular and maxilla. As well, you see the sphenoidal bone here, frontal bone, parietal bone, and occipital bone. This is the sagittal section, but here you see the horizontal or axillar section. And this is interesting kind of tomography we call spiral computed tomography. And it combine all sections in the three-dimensional object that is a real skull for the patient, and all structure are visible. It is very good to see to see the fractures when the problems with the damages, all of fissure of fractures are visible. As I see here, this is the skull fracture, very heavy, because the damage of orbits and damage of the nasal cavity. And as you see, these patients is in the clinic with the artificial breathing. This is a tube to the lungs. But here is the cause of the nasal tumor. Inside of nasal cavity, there is quite large tumor. As you see, the people is very old because no teeth on the upper jaw or maxilla, but only some of teeth on the level. That's all for now, my friend, and I'm ready to your question. So I'm waiting your question for this lecture. Don't forget that we prepared the test for the skull lecture. We will have also next. We will also have another one lecture about skull bones and skull joints, and it will be about development of the skull bones as well as about skull joints. This lecture will be on the same time, 16:10 on Monday, next Monday. Okay. Thank you for warm words. If you have no question, then just open our electronic educational system called Moodle and find the test. You have passed this test today or tomorrow before 17. It will be open before 17. Thank you very much. See you next Monday and have a nice evening, my friend.